Good evening. I call to order the Lee County Board of Commissioners this Monday, August 19th at 2024. And if you would be so kind as to stand for the invocation, followed by the Pledge of Allegiance. Heavenly Father, we give thanks for this day. We do ask that you bless this board, the duties of this county, as we work to continue with the work of the citizens. We ask for a blessing upon those in attendance and give safe passage for them to return home. We ask that you guide us in the righteousness of protecting life, liberty, and property within the county of Lee. In your most holy and precious name, amen. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We wish to thank everyone for attending this evening. We have a special award to present to our gymnastics. That's all the medal that you hear, so I apologize. They did such a great job. So we appreciate you being here, and ladies, no problem. Make all the noise you wish. Before we move on to the agenda, I have an item on the agenda from moving new business. Item number 7B, Trillium Health Services Annual Report. We're going to move that to before public hearings between item 4 and 5, simply because the staff has to return back to Wilmington tonight. And I would put them forward regarding that. Also at your desk, please note that item 2R has been replaced and the actual issue is at your desk. And that's in regards to the body armor purchase for the sheriff's office. Anything else for the agenda? Do I have a motion to approve?
We have this closed session on there?
Oh.
Did you put the closed session?
Closed session's already on your agenda.
Chair.
Yes, ma'am.
Smith, I would like to, if we can pull 2G from the consent agenda, or at least to be able to,
To discuss?
yes, sir.
We can place that under new business. Followed resolution and community support services, Lee County Consolidated Human Services. So we'll put 2G. Any other changes to the agenda or the consent agenda?
For item 2K, can we move to the new business as well?
Item
For
2K,
discussion,
budget
yes, sir.
amendment, okay. Anything else? All right. Do I have a motion to approve the agenda as modified?
So moved.
Motion's been made to approve the agenda as modified. Any questions? Any discussion? All those in favor signify by saying aye.
Aye.
Any opposed? Thank you. Do I have a motion to approve the consent agenda as modified?
So moved.
Motion's been made to approve the consent agenda as modified. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? Thank you. We have 2 public comments this evening. And just a reminder for those coming forward to speak, I would ask that you cite your name as well as your address. And you will have 3 minutes to speak. And just a reminder for the rest of you in the audience, if you are not familiar, please turn off the ringer on your phone. I used to do this with my college students. If it rings, we will stop and we'll let you answer it. All right, first for public comments is Meg Moss. Good evening.
Good evening. My name is Meg Moss. I live at 364 Sheriff Watson Road, Sanford, 27332. I am here to talk to you about reasons that theater education in public schools is so important. First, it teaches social tolerance and empathy because it asks students to walk in another person's shoes and sees things from another viewpoint. Second, theater creates strong communicators, to include teaching the importance of eye contact. 3, theater demands creative thinking and problem solving, and it builds confidence. These are things that are good for employees in our future workforce. So even if students' long-term goal is not being on Broadway or even professional theater of any kind, these are important life skills. So let's help them develop these soft skills for career readiness. Theater also improves reading comprehension. For example, my son, who is a freshman at Southern Lee, was in a play at Temple Theater 2 years ago, Macbeth. And when we went into open house, we found out that he's going to be reading Macbeth in his English 2 honors class. And he's like, I've already read that. So we're preparing them for success. So not every student has the opportunity to train at Temple Theater or other professional theaters, and that is why it is so important that public education plays a role in this. And when it does come time to upgrade and build the school auditoriums, I encourage you all to consider the quality of the auditorium to include exceptional sound and lighting. I have been to shows at our local high school auditorium and at theaters in a school in Wake Forest, where the sound was superior to ours. I understand we are very different communities, but our children deserve the very best. Thank you.
Thank you. Next on the list is Jim Womack.
My name is Jim Womack. I live at 1615 Boone Trail Road here in Sanford. Here just to mention 2 or 3 things for you tonight. First, let me start with an apology to the public and to the Board of Commissioners. I haven't been as attentive personally and professionally as I should have been to the capital improvement program and the budget for the county over the last several years, entrusting that to your sage wisdom. But recently I've had the opportunity to go in and look at in more detail at the wonderful documents that are posted out there at the Finance Department's website, because there's a ton of material there, and you can go back historically and look at a lot of the things that we've done over the years. And I was really disturbed by the fact that even though we've gone to the lowest in history tax rate in Lee County recently, the increase in property values took our overall tax burden higher for almost every citizen that I know. Substantially higher. Some people paying 40% more in taxes this year, in a year where we really couldn't afford it. A year where inflation was running rampant because of the administration in Washington and all these other problems, and people really couldn't afford to pay a higher tax burden this year, and they had to pay it. Then I went deeper into the budget, deeper into the spending plans, and I noticed that there's some things that we're spending a lot of money on, tens of millions of dollars on things that are not required by law. Things that are not necessary for operating the county in a safe and secure manner. Things that are not necessary for having a quality education or a workforce in the community. These are nice to have things that are not really required. And then I find that cost escalation has driven up things like the soccer complex, the industrial park that we're building, or the soccer park. That thing is grossly over budget of what was originally planned. And now we're trying to pay for a lot of that as we go because the bond was only $25 million. And I'm thinking to myself, man, if I was still a commissioner, I'd be taking a haircut. I'd be saying, look, this is all we appropriated through the bond. This is all we're going to spend on it. And the rest of that money needs to go to other things we have to have. We got $77 million that's sitting in an out-year plan for the new jail. It'll cost $100 million by the time we get there. And we're not planning effectively for it. We got to do that. We know we have to build a new jail because the old jail's inadequate. I mean, we're already out of standards, out of compliance. And I'm just thinking, we need to take a step back, this community, and relook our priorities. Make sure we're paying for the things we have to pay for by law, and that we're giving ourselves a proper landscape for economic growth and development, and not spend so much money on things we don't have to spend money on. I think it's time that we wake up and start being fiscal conservative like we all know we should be. And I'll reserve the rest of my comments for the bond hearing. Thank you.
Thank you, sir. And I was out of sequence on the agenda, so the next item is the recognition of the North Carolina Association of County Commissions Excellence in Innovation Project Award. Amy Basin is from the North Carolina Association of County Commissioners, and we thank you for coming down from Raleigh, Amy. Thank you very much. Just a side note, we're going to present this award at the North Carolina Association of County Commissions annual meeting in Winston-Salem, but we had Debbie visit, so the staff didn't travel that way. And I apologize for Debbie, but Amy, it's all yours.
Well, I apologize for Debbie as well, but it is an honor to get to be here, so I'm actually glad that that worked out. Thank you, Chairman Smith. Thank you, Commissioners and Manager and Attorney, for allowing us to be here and just take a few minutes. I know you have a very busy and important agenda, but I hope that this will allow just a few minutes to honor the great work that Lee County has done. Again, I'm Amy Basin, and I am with your Association of County Commissioners. We are here for you for anything that you need, and I'm leaving behind a little giveaway. It is a map book that we produce through the association, so hopefully you'll find that to have some helpful information that you can use. Do not hesitate to reach out for anything that you might need. I also want to mention that your county manager mentor serves on our risk management board of trustees, and we greatly appreciate the work that she does in that space, speaking of storms. So thank you for that. The first thing I would like to do here is I would like to recognize that we, at the Association of County Commissioners, we partner with the Civic Local Federal Credit Union to have Excellence in Innovation Awards, and one of the awards this year was given to Lee County. And if you'll just give me or allow me to have a moment, I'd like to read about the program that was recognized so that the commissioners and the public can understand what a great program this is. So Lee County was recognized, and it's a panel of judges who look at and review the applications and recognize Lee County for the Renew program. Over the past several years, many health and human services departments have seen an increase in mental health-related challenges, and these challenges have put a strain on local county systems. Lee County leadership came together to provide a possible solution to bridge the gaps in services within the community, and as a result, the resources for eliminating barriers, creating new beginnings, and providing education for an enhanced well-being, or Renew Lee County, was born. And this, you all have had a health and well-being initiative, reentry program, community social worker, pretrial release, opioid use disorder reduction initiative, and have done a tremendous amount of work in Lee County. Based on this, the association recognized you with this beautiful award, and I don't know if we have anyone here who is part of the program that.
Please, staff, come on, come on, don't be shy. Come on,
But we would like to honor you
attorneys included.
and thank you for the work that you have done for Lee County.
Amy, we still have,
Can I get a picture?
oh, Amy, we're going to get a picture
Get
with all of
pictures?
us up
Okay.
here.
Okay, we'll get
We're
pictures
getting
then.
everybody
I will
together.
be remiss in my duties if I return without pictures, so thank you for that.
Absolutely.
Wonderful, thank you. And Chair Smith, I have one other item of business, if you will allow.
Yes, ma'am.
In addition to honoring the county for the work that it does, I also want to honor a specific person that you have on staff who has done a tremendous amount of work, and she is your county attorney, who was recognized this year by her colleagues at the Association of County Attorneys annual conference, and also was recognized at our annual conference, but unfortunately she was unable to attend. But as you know, you have a gem in Whitney Parish, and just to give you a little bit of background, she's a native of Lee County, a graduate of Meredith College and Elon University School of Law. She has served with her as the president and now past president of the County Attorneys Association, and is an excellent resource. We still go to her to get advice and help with other legal issues across the state. She served as a parliamentarian at our Legislative Goals Conference, and she has worked in the development of an internship program to encourage new people to come into the profession. We are truly grateful for the work that she has done for the association and county attorneys across the state, and I know that you appreciate the work she does here in Lee County. So I'd like to present this to you.
We might as well go up and get our picture taken, so. Please. Christie's going to stand here. I understand you're the coach? How many years?
I've been coaching 34 years. I've been here 3.
3 years. Don't leave.
I'll do my best.
I have a proclamation recognizing the achievements of the Lee County Gymnastics team. You can all applaud. Whereas the Lee County Gymnastics team exhibited hard work, dedication, and exceptional talent in their recent competitions and throughout the 2020-24 season. And whereas 11 gymnasts represented Lee County and competed at the AAU National Championship in Daytona Beach, Florida, June 20th through 23, along with 3,000 gymnasts from across the country. And whereas during this competition, the Lee County gymnasts received 9 gold, 6 silver, and 5 bronze medals, along with 1 national champion who received first place in the all-around event division, one of which received a plaque and a pin for being the highest scoring platinum in their session. And whereas 19 gymnasts represented Lee County and competed at the AAU Southern Regional Championships in Dalton, Georgia, May 10 through 12, along with gymnasts from across the region. And whereas during the competition, the Lee County gymnasts received 7 gold, 11 silver, and 9 bronze medals, along with 3 regional champions who received first place in the all-around event division, and 2 silver all-around medalists, and 1 bronze all-around medalist. And whereas earlier in the season, the Lee County Gymnastics team attended the AAU State Championship in Greensboro, North Carolina on April 26th through 28th, facing over 1,000 fierce competitors at the highest division and levels. And whereas the Lee County gymnasts were successful and brought home their highest scores of the season, resulting in the crowning of many state champions, including 24 gold medalists, 20 silver medalists, and 17 bronze medalists, as well as 5 all-around gold medalists and 4 all-around silver medalists. Whereas the Lee County Gymnastics team was victorious in their endeavors, held the values and morals of Lee County above all else, displayed grace in victory and dignity in defeat, and embodied the true meaning of teamwork and sportsmanship, which will carry them to success in future seasons and in life. And now, therefore, the Lee County Board of Commissioners hereby proclaim Tuesday, August 22nd, 2024, as Lee County Gymnastics Team Day in Lee County, North Carolina, and call upon the residents to observe this day, recognizing and celebrating the team and their contributions to and successes shared with the Lee County community, presented this 19th day of August 2024. I would like to add that the new facility that we have at the Moore Center is fantastic, and it's a great opportunity to, if you haven't visited there, wander on in. They're busy, it's big, it's booming, and there's all sorts of things happening, and we appreciate it. And congratulations, ladies. Do I have a motion to accept this proclamation? Motion's been made to accept the proclamation recognizing the achievements of the Lee County Gymnastics team. All those in favor signify by saying aye. Aye. Any opposed? Motion carries. Thank you. What we'd like to do is everybody come forward. We're all going to get a picture. They'll have it in front of the seal. And please rattle all the way. It's good.
Killer.
Yeah, I totally missed that because I'm sitting there going,
Oh, yeah, that's okay.
That's what I'm here for. We have a great team. We keep each other straight. I was gonna, yeah, please, I was like, oh, something's missing.
I didn't get it.
Well, as the board has.
Again, I can't say enough for the Moore Center facility that we have where we were leasing over by the Holiday Inn for years and years, and our youngest granddaughter participated in gymnastics, and every once in a while I'd bump into Whitney there, but that was really tight in there. And to see this program expand as it has and the competition they've been involved in is impressive, and it's great to see something like that. All right, next item on the agenda is the Trillium Health Resources Annual Presentation. Cecilia Pierce.
Good evening, Chairman Smith and County Commissioners. Thank you so much for having us in this evening. I am here to provide you with an update on Medicaid managed care through Trillium, some changes that we have gone through over the last year related to consolidation, and talk a little bit about Trillium's impact on services for the residents in Lee County. Before I move into that, just want to thank Commissioner Smith for joining our Southern Regional Advisory Board, and also for Walter Ferguson for joining the board and serving on our governing board. Those appointments have been crucial for Trillium and Lee County to establish a good relationship since consolidation, and just to continue to work together. And we really appreciate the county's dedication to individuals who have behavioral health needs here, and your work to help improve their lives, which is really our collective goal. Next slide. So just to provide a little bit of an overview, Trillium covers services and supports for people with Medicaid who have the most significant mental health, substance use, intellectual and developmental disabilities, and traumatic brain injury needs, as well as those who are uninsured or underinsured and have behavioral health and IDD needs as well. There have been many changes over the past year, primarily guided by General Assembly legislation. Much of that has been focused on completing the process of Medicaid transformation in North Carolina. That process really was designed to bring the physical health and the behavioral health networks under one plan for individuals who receive Medicaid. The LME MCOs have been working towards becoming tailored plans, having those networks underneath of us for the last couple of years. And we've experienced some delays in relation to that. And so primarily the legislation was really designed to move tailored plans forward and allow them to launch so that we could complete the Medicaid transformation process in North Carolina. So the General Assembly took some action related to their budget legislation, included in their budget legislation to move those tailored plans forward. One step was to reduce the number of LME MCOs down from 6 to either 4 or 5. And they put that decision in the hands of the DHHS Secretary, Cody Kinsley, to manage that process. And then another step was to increase the minimum population of LME MCOs up to at least 1.5 million. And this was really to help with mitigate the financial risk of covering both the behavioral health and now the physical health needs of our members. And then it established a new launch date for the tailored plans of July 1st of this year. So before I move into consolidation, I do want to say that we are very excited that we launched as a tailored plan on July 1st, and I'll talk a little bit more about that a little bit later on, but that was successful. So in order to follow that directive from the General Assembly, the DHHS Secretary issued a directive on November 1st requiring the reduction of LME MCOs down to 4. And so what that did was it dissolved the Sandhill Center and moved that into East Point, which is another LME MCO. It required Trillium and East Point to then consolidate into one entity. And this essentially, even though there was a two-step process in this, happened basically simultaneously. So you'll see the timeline here. It was a very tight timeline from November 1st when the directive came out to February 1st when Trillium began to serve members in all of the counties through this consolidation process. And so we had some priorities during that process. First and foremost was to ensure the continuity of care in all of the counties that were becoming part of Trillium. So in order to do that, we ensured that all of the providers that were contracted with Legacy Sandhills and Legacy East Point LME MCOs were contracted with Trillium as long as they were in good standing. We also wanted to ensure that operations could continue effectively. And so as part of that consolidation agreement, we brought on all of the staff from Legacy Sandhills and East Point into Trillium at their same salary with continued equal benefits as long as they were willing to join the organization. We lost a few staff during that process, but very few. Most staff chose to join and continue to be with us as an organization. And a lot of those folks that you were working with before, you continue to work with, including our own Ann Kimball, who's here with me as the Director of Community Engagement and Empowerment. And so Trillium went from being 28 counties to being an LME MCO that covers 46 counties. We have those 18 counties through Sandhills and East Point that joined Trillium with additional 900 plus staff. And also we onboarded an additional 900 or so providers into our network to ensure that continuity of care. Next slide. So just wanted to share a map of our new catchment area. All of the counties that Trillium covers are in that green area. So the total population in our catchment area is 3.1 million, with 51,000 tailored plan members, 163,000 Medicaid Direct members, and 287,000 people who are uninsured and receiving support through those state funds. So the other three LME MCOs are Alliance in pink, Partners in blue, and VIA in the light blue. And one of the things that I like to point out is that Alliance in the pink has a population of about 3.5 million, whereas Trillium has a population coverage of 3.1. So populations are fairly similar, but the concentration of people in the Alliance catchment area makes their service delivery and Trillium service delivery and the needs of our members look a lot different. Most of our counties are very rural and experience challenges around maintaining providers and maintaining their client population, also transportation and other social determinants of health concerns. And so one of the things that Trillium really likes to focus on is ways that we can deliver service, even facing some of the challenges that rural communities face, because we want to make sure that everyone has opportunities to access the same level of care, whether you're in a rural or urban environment. Next slide, please. So when Trillium was 28 counties, we had our region divided up, we had our catchment area divided up into 3 regions, which allowed us to have a more local focus by concentrating our efforts on a smaller number of counties at a time. When we consolidated, we split our catchment area up into 5 regions to continue to maintain that local presence and really focus in on more local needs of our counties. So Lee County is part of our southern region there in the blue, also including New Hanover, Brunswick, Columbus, Bladen, Robeson, Scotland, Hoke, and Moore counties. So there's a 9-county region. And each region has a team that is focused on community engagement. So myself as the regional vice president, and Kimball as our Director of Community Engagement and Empowerment, and Pamela Munger all serve as the folks within Trillium that are the community and stakeholder primary points of contact. So if folks have questions, if there are events and activities that are happening in the community, if there are initiatives that carry over into our shared members, we want to be involved in that. And so we have this local focus so that we can continue to do that while still having a significant number of counties in our catchment area. One of the other things that we've done with our regional makeup is that we have a regional advisory board. And so as I mentioned, Commissioner Smith serves on that regional advisory board. Each regional board has a commissioner and a non-commissioner appointee, as well as a member of the Consumer and Family Advisory Committee. So we have that local presence at the regional advisory board level, and those boards appoint up representatives to our governing board. And so that's how we are able to have the local voice moved up to the governance level of our organization. So I'll shift over to talk a little bit more about the tailored plan. So that is for some Trillium members, a plan that includes both the physical health and behavioral health services under one health plan. And so not only are we managing that behavioral health care, we have pharmacy benefits under our network, and we also manage the non-emergency medical transportation. So with Medicaid transformation in North Carolina, standard plans, those commercial health plans listed here on the slide, such as AmeriHealth, Blue Cross and Blue Shield, United Healthcare, they started operating with the physical and behavioral health networks combined in July of 2021. And they serve approximately 70% of the folks who are covered under Medicaid in the county. Trillium, because we work with the folks who have the most significant needs, we cover about 25 to 30% of that population. Next slide. Another piece of legislation and a change happening in North Carolina is the statewide Children and Families Specialty Plan. So in the General Assembly, they issued a request for a proposal for a single health plan to cover the children who are involved in foster care and their families in a specialty plan throughout the state. So previously, those children were covered under LME MCOs, and they will move under one plan throughout the state. So the start date was set by DHHS for December 1st, and that plan is designed to serve children, youth, and families, addressing both their physical and behavioral health needs and intellectual and developmental disabilities, similar to the tailored plan, but with the specialty population. So recently, last week actually, DHHS announced that they chose Blue Cross and Blue Shield to manage that plan for the state. The launch date is still posted as December 1st, so that could change, but that is the current launch date as announced. Next slide. So the cornerstone in terms of service with the tailored plan is tailored care management. This is whole person care management, which we launched as a soft launch in December 2022. And this is really designed to support our members and work alongside them in developing a plan of care that is monitored and addressed throughout the year with a team of experts, both on the behavioral health side or intellectual and developmental disability side, as well as the physical health side with doctors and nurses and pharmacists on our team. Tailored care management is plan-based and can also be provider-based. So we internally as Trillium can serve as a tailored care management entity, but we also contract with providers to offer that service as well, so that members can have choice in who they want to receive their care management from. In terms of Trillium's approach to tailored care management, we see the need for some specialized teams with some particularly vulnerable populations or populations that need additional coordination in order to be successful. One of those populations is individuals who are returning from jail or prison, and they are supported by our T-STAR team, which is Trillium's Support, Transition, and Reentry. We also have a rapid access care coordination team, so when a child moves into foster care or under the support of DSS, that team is mobilized to make sure that they have access to the services that they need. And then we have a team under Sean Kenny that focuses particularly on care management while a child is in foster care. We also have a Department of Juvenile Justice engagement team that works across our juvenile justice systems throughout the region to make sure that kids who are involved in that system are getting the care that they need. And then within our care management department, we also have a population health department that is really focused on managing those most concerning health needs like chronic conditions, focused on smoking cessation, and high-risk pregnancies and maternal health. Next slide. So getting into Trillium and our service in Lee County, most of this data was actually collected by Legacy Sandhills. So we're moving into the transition from Sandhills to Trillium. In the last fiscal year, around 1,600 members were served in Lee County. 75% were adults, and 25% were children. And you can see some of the breakdowns. The highest number in terms of population, 44% of adults were served with mental health concerns. 16% of children had mental health concerns. Next slide. And so what we like to do also is to identify the providers within our network that have the highest number of members served. And so Daymark, kind of above and beyond, serves a lot of our members in Lee County, followed by VC and Associates and Sanford Treatment Center. And that really speaks to the previous slide with 44% of adults needing behavioral health services. And then in terms of the most frequent services that are received in the last calendar year, the intermediate care facilities, those are the highest level of care for adults with developmental disabilities who typically have some significant physical health needs. Those were the cost of service paid for those facilities was a little over $6 million, followed by the innovation services, which are also a set of services that are enhanced for those individuals with intellectual and developmental disabilities at a little over $6 million, and then outpatient services at around $1.5 million. Next slide. So we wanted to share a few updates around projects that are either ongoing or just beginning in Lee County here. So one of the things we like to highlight is Trillium's partnership with the Healing Place and Healing Transitions. Both of those facilities are peer support-based recovery residential facilities. They both have a non-medical detox, a shelter, and a phased residential recovery program. And individuals who are in recovery from substance use can stay there for a year or more to help get them stable in their recovery. Healing Transitions is going to be a lot closer to Lee County. They're in Raleigh. The Healing Place is a newer facility in New Hanover County that has 200 beds, 100 for men and 100 for women. So a little bit larger facility, but a little bit farther away. We utilize some of the county dollars that Lee provides in support to help folks coming from the county who want to go to Healing Transitions to pay for their stay there. So there's no cost to the members, and that's how we utilize some of those funds. One of the other things that our training department is doing is hosting a series of health summits focused on health equity and population health. So our most recent health summit was focused on Native American health, and that happened in April. And then we have a heart health summit planned for October. And we'll continue to do those over the next year. As we entered into the new fiscal year, we're planning those out for the next, for the 2025 fiscal year. We partnered with Chess Health to offer a recovery app on the phone for people who are in substance use recovery as well. We know an app is just one of those tools that someone has in their hand to help with recovery, so it helps our members locate a meeting if they want to go to a meeting near them. It helps them set up a recovery plan that they will have at the tip of their fingers. And if they're really struggling, there's some peer support and some other supports built into that app to help them stay focused on their recovery plan. As always, one of the things that has remained strong between the consolidation of Sandhills and Trillium is our in-person and virtual training options. And so we offer the CIT training, which Commissioner Smith is very involved in. That provides law enforcement with support and understanding around addressing mental health, substance use, and IDD needs in the population when one of those individuals is in crisis. We have mental health first aid training focused on adult and youth mental health. QPR is a question, persuade, refer training, and that's focused on suicide prevention. Community crisis intervention is like CIT, but for folks who maybe work in the community, not law enforcement or first responders, but who may work very closely with people who are at risk for a behavioral health crisis. And then our Responder Strong training is focused on first responders and building their resilience as they have to address mental health and substance use challenges in our community that may cause them personal stress or their family stress. That Responder Strong training is focused on our first responders and helping build them up so that they can continue to do the great work that they're doing in serving our community. The virtual training piece is through a module called My Learning Campus on Trillium's website, and it has a wide variety of trainings focused on members, on caregivers and professionals. One of the things, since we are getting ready to start the school year, I like to point out is Safe Schools, Healthy Kids is a module on our website that focuses on concerns and needs of children who are school age. So whether it's bullying, depression, signs of violence or gang involvement, there are training modules and tip sheets for children, parents, and educators around the needs of children. And then Victory Junction, we partner with them for family weekends in the spring and fall. And that's for any Trillium member and their family to have a camp experience when they wouldn't typically be able to access a camp, either for financial reasons or because camps can't accommodate their physical or behavioral health needs. And so Victory Junction is equipped as an inclusive camp, and they have just a lot of fun activities, and it provides a great way for our members and families to relax and have a fun time as a family together. Last slide. So just wanted to make sure you all have the information. Our member and recipient line is the easiest way to get connected to Trillium. That's that 877 number. It's available Monday through Saturday, 7 a.m. to 6 p.m. If a person is in a behavioral health crisis, they can call the behavioral health crisis line directly, or even if they call the member and recipient service line, they can get transferred over to that crisis line. And the crisis line is 24/7, and it's staffed by clinicians. And then your regional operations contacts are listed here, myself, Ann Kimball, and Pamela Munger. General questions can go to that info@TrilliumNC website. So we really want to be available to you as a community and be able to answer any questions that you have. So I will close and take any questions.
Thank you, Cecilia. Questions for Cecilia? Commissioner Sharp?
Thank you for your presentation,
Absolutely.
but I don't have any questions.
Commissioner Vorbeck?
You had mentioned the Safe Schools, Healthy Kids. Are the school systems aware that is there information that's been provided to them that they're able to get out to the parents?
So we've had some initial meetings with school systems as soon as we went through the consolidation, but that is one area where we probably should go back and revisit that and make them aware, just because with the start of school, I think, a lot is on our minds, so I will make sure to go back and make sure our school systems are aware that that's available.
Okay, yeah, because we're in school here in Lee County, so we're in. And then my second question, and it came up at a previous meeting, and I kind of just want to make sure I understood it correctly. If anyone were to call this behavioral crisis line and they are not a member, you guys do a very good job at directing them where they can get help, correct?
Absolutely.
Okay.
Yep. We are not going to say you're not our member and hang up the phone. We are going to make sure that they get connected with the right service. One of the services that is available to anyone, regardless of insurance, is mobile crisis management.
Okay, I knew there
And-
was something. Okay,
And so
thank you.
we're likely to refer over to a mobile crisis team or to connect to law enforcement if there's a safety issue. But we will make sure that they're connected to a crisis service. Absolutely.
Thank you.
Yep.
Commissioner Connect.
Thank you.
Commissioner Mark Lovick.
No questions for you, but thank you so much for the good information and the great presentation. Thank you so much.
Commissioner Carver.
Thanks again for your presentation. Do you have any play in trying to help with the problem of people who are incarcerated or really mental health issues? In other words, is there a coordination between law enforcement and you all, especially in that transition when they end up ending their period of time?
So we have a team that's just getting started, that Trillium Transition and Reentry program that I was talking about, where our care managers, if a member was engaged with Trillium prior to incarceration, our care managers will reach out in the jail at least 30 days prior to release and help with the care management process to get folks connected to a provider so that when they're released, they will have some supports in place which will help them have more of a successful reentry. And we've also been working with Ms. Autumn Smith to make sure that assessments are available when they're needed and able to be covered by Trillium. Once folks go into jail or prison, Medicaid is no longer available, and so that's when we have to stop serving individuals, but we can now kind of get that process started again pre-release, which is what we're focusing on. So
Can you also identify people who are not on Medicaid or whatever, identify them, because law enforcement is smart to see that that person really needs help, and then you can grease the skids to get them the kind of care they need once they get out? Is that something you do?
we can try to do that. I think that's one of the goals of the CIT training. So when an officer identifies someone as having more mental health or substance use needs, rather than being a safety issue, concern to the community, then they're given the skills and the knowledge to get folks connected to services. So we try to help inform law enforcement through the CIT training, and then also through that mobile crisis management. So we really like to defer those non-safety issues to mobile crisis, where there's qualified mental health professionals that are focusing on that crisis and getting people connected to care very quickly.
So a person that's actually incarcerated could start communicating with that help that they might need before they get out? The idea is that you don't want them to just have to face that change as soon as they leave.
Yes, yeah.
But they can?
That would be-
They have tablets and things like that, so.
That would be through that T-STAR team, that they
I
could get
see.
care management prior to release.
Awesome, thank you.
Absolutely, thanks.
If I can add on to that issue with the incarcerated members of the community. Autumn, is there a way that, and I know we pay for health care for the jail inmates. Do we not have a video program that we connect with mental health providers while the individual's in jail? And if so, who pays for that?
So, payment part, I'm not 100% sure. I know Ms. Brayboy has been working with the T-STAR team, with the reentry for Trillium to try to figure out the pathway. I know she's been working with the jail on some video visitation and sort of making the tablets more accessible. I'm not 100% sure about the cost.
We do have a provider for the mental health services that's done virtually, and we do pay for it, the county does.
Okay.
It's part of the jail budget.
Thank you. I sign all these things. I know we have a contract. Just to add to it, and I know you are aware, the innovations waivers, the registry of unmet needs, every time we go to the legislature, I know I bug Senator Bergen and Representative Sauls. So I just wanted to let you know that we're still very concerned about that, because
Thank
we do
you.
have members in the community
Yeah.
not being met as far as innovations waivers.
Thank you for advocating for that. That waiting list is longer than the number of people who actually receive those waivers, and so we know that there are people who need a certain set of services who aren't receiving them at this time. So we appreciate the partnership with requesting more waivers.
And I hate to make this snide remark, but it seems that gambling is more important than mental health, and yet we're contributing to the issue with our legislation on gambling. So I made my point. I'll stop. Thank you, Cecilia, for coming down. Thank you, Ann, for coming. You're more than welcome to be excused. Please drive safely on your way home to Wilmington. No speeding, wear your seatbelt, and be careful.
Thank you for moving us up on the agenda
Thank you.
and back to our respective locations.
Thank you. And do take care, both of you. Okay, the next item on the agenda is public hearings for the fiscal year 2024 Community Development Block Grant Program. Mrs. Kennedy is here. Treadell, you feel free to join her.
I was going to introduce him. Good evening. Thank you for having us here for our public hearing. Treadell Atkins is a planner in our department that has come out doing wonderful things, and he's learning everything we do so that he can take over doing this great work. So I'm glad to have him. And while I'm introducing, we also have Chris Hilbert with Insight Planning here that will be helping us with this application also. Thank you. Tonight's public hearing is one of 2 required public hearings when you are submitting a small cities community development block grant program. The purpose of the public hearing is to allow residents and citizens an opportunity to express views concerning community development priorities, funding and eligible activities, and review program compliance. The funding for this program comes from the Department of Housing and Urban Development, but it is processed through the North Carolina Department of Commerce because we in our community are considered a small cities, counties community. So we apply for our funding in a competitive manner every few years. The CDBG program activities must meet one of 3 national objectives: benefit to low and moderate income persons, prevention or elimination of slum and blight, or in addressing an urgent need. As I stated before, there are small cities except the 24 entitlement municipalities and all North Carolina counties except Cumberland, Mecklenburg, Union, and Wake are available to apply for this funding. It can provide a wide variety of community development activities. This program, Neighborhood Revitalization, is administered by the Department of Commerce, the Rural Economic Development Division. There's approximately $12.29 million available, and the maximum award for each application is $950,000. There are no matching funds required, and the projects must focus on low and moderate income housing-related activities for individuals that are at least 51% low and moderate income persons and 100% for direct benefits. So area-wide project benefit, if we were to pick an area, 51% of the area must be low and moderate income. For direct benefit programs like housing rehab, each home must be low and moderate income person. It supports 3 livability principles to promote equitable, affordable housing, supporting existing communities, and a project that values communities and neighborhoods. The activities can include community revitalization, housing rehabilitation, clearance, relocation, substantial housing rehabilitation, reconstruction and replacement of homes, emergency repairs, infrastructure and public improvements, scattered site housing, public facilities and improvements for special needs such as shelters for domestic violence or homeless families, transitional housing, and non-homeless persons with special needs. single-family home ownership development, multifamily rental housing development, and infrastructure activities such as water and sewer when we do connections to existing housing and administration. These applications are due by October 23rd, and I will have to conduct another public hearing before October 23rd. So I will be back to see you when we have moved this application along. The formal public hearings must be held with each application. Part of this requirement for this is a housing selection committee. So I'd like to work with the county manager for either one of you to volunteer or a staff member for Lee County to be on this committee for the next few months as we select homes. As a reminder, the city and Lee County both have had a long history of receiving community development block grant funds. You are partners with the Washington Avenue project that is underway right now and the Jackson Heights project that Brick Capital is doing. You also are working with the American Rescue Funds for a Lee County home repair program. And so we have a really good history of receiving these fundings. Because the city has 2 open projects totaling about $6 million, we thought that it might be better if we did this application through Lee County. Because in the past, pre the legislature taking away housing rehabilitation funds, regional allocations were given to the county. You all received them in 2002, 2005, 2008, and 2011. And that was the last funding that you all received for our county for housing rehab. So we thought that this might be a good way with all the programs we already have in place, urgent repair, single-family rehab, to go back to a focus on housing rehab for our community residents. It's also a great partnership because urgent repair and single-family rehab have certain criteria for their housing, and this program would get to the housing that may not be addressed for the other community residents. It will be countywide, as is every program we do. It's not specific to an incorporated area or an unincorporated area. It would be countywide for all applicants. I will pause there if you have any questions, and so you could open the public hearing.
Questions for Karen or Trudell? Commissioner Carver?
I don't have a question, but I want to make an observation, is that I think the way you work with the county and the county works with you is an excellent example of the kind of things that it's just very encouraging. I've talked to our county manager about the way that you're working together on this block grant thing. And I appreciate the way you're looking over your shoulder, what's happening over here, and we're helping you back the other way. It's just a good example.
Thank you.
So thank you.
I think the partnership and the merger with our planning and community development department that you all had insight, or your predecessors did, has worked really well. Because when I first came here a minute ago, there was a county staff or two that did community development and a city staff. We were competing against each other. And funders always thought that interesting because we're such a small community, why we would compete against each other. So the interlocal agreements, the planning contract have served us entire community well, because we don't ever go into a project thinking, do you live in the city? Do you live outside the city? Do you live in the town of Broadway? The projects are open for everybody. So that has worked really well. Thank you for that compliment.
Commissioner Lovick?
No questions, just a comment. Like I say, partnering with the county, that is good, because it's surprisingly how many county citizens think because they live in the city limits, where they're not county people. But given this presentation, maybe we'll show that the county and the city are partnered together on these things, and it sounded like you were getting ready to retire. I'll leave it right there.
No, not yet. We are putting things in place, though, for Trudell to learn everything he needs to know.
Thank you.
Commissioner Connect?
I'm good. Good to see you.
Commissioner Vorbeck?
Did I hear you correctly on October 23rd is
Yes, ma'am.
when the dates of, okay. And then the next, you'll be able to bring us something.
For the second public hearing, I will bring you back the application information, the budget information. That is what's required, because from now until October, are hoping that local citizens that have a housing rehabilitation need for their home that are not already in our urgent repair and single-family rehab program with open applications will reach out to Tredell or I.
Okay, yes, because I know your list is quite long on those.
It is.
Okay, and then as far as getting the word out, since it is such a small time crunch, do you guys have a plan possibly in place to?
As I was stating, this complements the existing programs we have. Right now, the city has an urgent repair
Yes.
program open. The county and the city have the home repair program open. And we just took applications and received about 45. And so we've been working these individuals and have assessments. And we know if they can't fit in the IRP and they can't fit in the home repair, they might be a great fit for this. We've already got a few people that have expressed interest in this program.
Okay.
And we are hoping some of the information from today's meeting will let other individuals know to reach out to us for information and application. And I think County Manager expressed to me some interest about the public hearing and the notice. We have to place a notice 10 days before the public hearing, and that allows for individuals to call or make written comments. We will do the same thing again with the next one, so that they can reach out, but they can reach out anytime about this program.
Thank you.
Commissioner Sharp?
So it sounds like you guys do some of the same stuff as Johnson Lee Harnett Community Action with the weatherization projects and things such as that. I know you're on that, but do y'all duplicate some of those?
We do not.
We do not, okay. They're not involved with you?
No, sir.
Okay, all right, thank you.
Karen, I understood you to allude to a volunteer from the board to be on this council or
Or
this committee.
staff, yes, either
Yeah.
one. I would
Do I
like to.
have a volunteer interested? Just throwing it out there. You may consider it and get back to us. If not, we'll have someone from the staff. Okay.
Tredell and I are meeting with Johanna tomorrow as our grant writer, just because we're going to do some grant training and learn how to do this type work. These applications are very technical, which is why we have taken on Insight to help us with the rehab piece.
No further questions. We will start with the public hearing. Let me get back to my notes here. All right, I'm going to open the public hearing for the fiscal year 2024 Community Development Block Grant Program application submissions. Public hearing is now open. Are there anyone that wishes to speak on behalf of this program? Please come forward, state your name, address. Is there anyone opposed to this program? Please come forward, state your name and address. Going once, going twice. Public hearing is now closed on the fiscal year 2024 Community Development Block Grant Program application submission. Thank you very much.
Thank you. We will also need a certified copy of the minutes and things to submit with the application for both of them. So, thank you.
Thank you. Next item on the public hearing is the new library and emergency communication systems financing. And Candace is here.
Good evening. Section 160A-20G of the General Statutes of North Carolina requires that the county hold a public hearing prior to issuing bonds. I'd like to request a public hearing on the proposed issuance of limited obligation bonds by the County of Lee, North Carolina, pursuant to 160A-20 of the General Statutes of North Carolina, as amended in an aggregate principal amount not to exceed $28 million for the purpose of providing funds together with other available funds to A, pay the cost of 1, acquiring, constructing, and equipping a new public library, and 2, providing various upgrades and improvements to the county's emergency communication system, and B, pay certain financing costs related thereto.
Questions for Candace? Commissioner Sharp?
I don't have any.
Commissioner Vorbeck?
Would you mind breaking out what the bonds are covering exactly?
So $22 million of the bonds is going to cover the library, and then the other $6 million will be for the emergency communications.
Okay, and then, because then on the next, and maybe I'm speaking, it says, I'm just trying to make the numbers make sense, because then the next item on our agenda states that the maximum price that we will be spending is 18.7. So I'm trying to figure out,
The 18, I'll take that.
Okay.
The 18.7 is the maximum amount for the construction of the library. There are other services and costs that we'll be incurring beyond that contract. And so that will make up the difference in that, like, we will have issuance cost of the bonds. You'll have other cost of furniture, some systems for the facility, for the upfit, and other things.
and then the 6 million was for the Viper,
Yes,
correct?
ma'am.
Okay.
And we also have contingency built into the projects also for other potential things that may come up.
And then once these are issued, what's the time frame on putting things forward?
Okay. We will be asking you to approve the GMP later tonight. So once the bonds are sold, we'll be coming back to have you officially approve various contracts
Okay.
with the different vendors that will be involved.
Okay. Okay, that's it that I have right now. Thank you.
Commissioner Connect?
Good, thank you.
Commissioner Lovick?
No questions, thank you.
Commissioner Carver?
No questions.
All right, seeing there are no questions, I will now open the public hearing on the limited obligation bond financing agreement in the principal amount not to exceed to $28 million for the purpose of providing funding together with other available funds to A, pay the cost of acquiring, constructing, and equipping a new public library, and providing various upgrades and improvements to the county's emergency communications system, collectively called the project, and pay certain financing costs related to thereof. Public hearing is now open. I would take any comments in for the limited obligation bond financing agreement. Do I have anyone opposed? Please come forward, sir. State your name as well as your address for the record.
Good evening, David Smoke, 96 Northridge Trail, 27332. As always, Commissioners, thank you for your time and efforts. I understand less than a week ago you were given almost 500 pages of documents to read, absorb, and vote on tonight, which is probably about an average amount of reading for you, but most citizens don't appreciate you having to do that before every meeting. There are lots of moving pieces, even with local government, and I am under the impression you are facing some timing challenges as well, but I'm going to explain my opposition to this bond package presented tonight. First of all, I am commenting on the 130 pages presented to the public regarding this bond hearing in the agenda packet. I did not read each word of that boring contract document. I skimmed through it several times looking for what I considered key information. So if I missed the information I am complaining about, I apologize right now. If there is additional information provided to commissioners that is somehow privileged information, then I retract some of my comments also, but it also adds to my concerns about the lack of transparency. Bottom line, if a friend or young soldier brought a loan packet to me like this to buy a car or finance a house, I would tell them not to be a clown or a mule, or even worse, a clown mule. The provided documents to the public do not say anything about the actual terms of this loan beyond the lawyer boilerplate legalese. What is the expected interest rates, term period, or some sort of amortization schedule? You're borrowing our money based on an almost blank contract to be filled in later, I'm sure. Hopefully not by Guido the loan shark. Even if exact numbers are not known until after the bond auction, there are good faith estimates that can be given based on market conditions. you should demand one. I understand there's a lot of pressure to get things moving and contracts signed, but if you do approve this tonight, I challenge our media to report that you voted to approve a $28 million bond without any public disclosure of time period or interest rates to pay it back. $28 million used to be a lot of money, but we know what the federal government is doing to that value. I also challenge the disclosure of how this money is being spent. I appreciate the questions that Commissioner Vorbeck just asked that answered some of them for me. In the agenda abstract, the increased spending of the library from $14 to $16 to $18.8 million now should make us all challenge the estimates given for other big spending projects being discussed in the coming years. The Viper radios were cited at $5.5 million a couple years ago, and in June they were listed at $6 million in the CIP, which added to comments in the past that I've made about inflation adjustments when projects are pushed out over the years. I added $18.8 million and $6 million and came out to $24.8. It was explained to me that the bond is actually covering $22 million for the library, plus 6, so that comes out to $28 million. I am still suspicious of the financing costs that are being built in there. It was disclosed in the abstract as certain financing costs without disclosing how much they would be. Once again, I'm sure the numbers will be filled in as we go, but the lack of upfront transparency to the public before holding a public hearing is really disheartening to me. Finally, I challenge the rush to finance $28 million right now without waiting a few weeks to see if the Federal Reserve does drop borrowing rates. Are the people that we approved paying over $160,000 in May giving us any sort of fiduciary advice? A quarter point of interest on $28 million is quite a bit of money to most of us. Once again, without knowing the terms, I could only guess that AA-rated muni bonds for 10 years at 2.8%. Running a basic interest calculator shows a quarter point interest rate cut would provide almost $900,000 in interest savings. In summary, I object to voting on this bond tonight based on the lack of disclosure, lack of transparency on how it will be spent, and the rush to approve it in an environment when rates are highly likely to go down in the near future. Thank you for your service as the stewards of our taxpayer monies. I know you were getting beat up all the time for not spending enough on all the different priorities that people have, while also hearing from us irate citizens that have gotten sharply increasing tax bills. Thank you.
Thank you, sir. Anyone for? Anyone wish to speak against? Yes, sir. State your name, your address, please.
Jim Womack, 1615 Boone Trail Road in Sanford. Okay, so there was some confusion tonight coming in here. I thought I saw one thing in the advance packet said you were going to send $7 million on the Viper radios, but apparently there was a misprint in one of the documents somewhere. So I'm glad to hear that it's $6 million. And I would just say that, you know, this, what I'm about to say does not have anything to do with the Viper radios, which are needed by law enforcement and emergency responders. They are certainly needed, and I don't think there's anyone that would question the need for that. My only comment about that is, why is that not pay-as-you-go? Why were we not able to absorb the cost of the necessary operational equipment like we do all other equipment? Why are we having to put a bond out for that? And I don't think anyone disagrees with needing the stuff. I think just with the growth of the county, there's no reason we shouldn't have been able to figure out how to do that as pay-as-you-go. It's operational equipment, it expires, it's not like a capital expenditure, and I just question that we needed to do that. Now the second part, and I'm probably going to lose my library card over this, this has been very poorly planned, this whole library. And I'm as much at fault as anyone, because I should have been sounding off 3 or 4 years ago when I saw it in the CIP and didn't think anything about it. But this county does not have to have by law a library. We have one now. It's not, you know, optimal. It's antiquated. It's got HVAC problems, and certainly it's got issues that could have been resolved over time. We could have done a temporary building, and we could have come back and built and upgraded that library so we could have used it. I question the fact that this county needs a 22 or a 20, whatever it's going to be, $22 million library, especially when we've got all these other demands, these other needs. Now, I've been told the library ship has sailed, that it's already a done deal. And in retrospect, so what I'm going to say here now is really applies to future planning. We should have done this under general obligation debt. If this was so doggone important, we should have done it under general obligation debt, which is what you put it to the voters. Let the voters decide that we need this thing. Don't make that decision on your own and then saddle us with higher interest debt to pay for that, because that's what we've done here. The debt, I'm sure Lisa knows this, the cost of debt right now is going through the roof, and it's not likely going to get a lot better anytime soon. The interest rates on this stuff is astronomical, and we're going to have to pay that debt burden. We're going to have to bear that, which means we can't lower taxes because we got a higher debt burden that we're having to pay over something we didn't have to have. So I just say to myself, and to you as well, you know, we can do better than this, folks. We can do better. We don't have to have that kind of debt saddling this county, because later on we're going to have to do some things we know we have to take general obligation debt out for. We're going to have to put it on the ballot, and I don't think anybody's going to vote against having a new jail when we know we have to have one. We're already out of tolerance with state and federal regulations on the jail. So I think we need to just do a better job planning and looking into the future, and in making sure that everything we're building and that we're financing is done using the appropriate debt instrument, and not doing it this way, because we're just burdening ourselves in the future, and we're going to hamstring ourselves. If the economy goes south, we go into a recession, it's going to get even worse. So I just, you know, I stand in opposition to taking on debt. Oh, one final thing. We definitely need to separate these two. These are two completely unrelated categories of expense. The Viper radios we know we have to have for communications and law enforcement and emergency responders. We know we got to have that. But why are we lumping that debt in together in two categories? Something we didn't have to have and something we do need to have together, and you know, that just makes me suspicious. Back when we did general obligation debt in 2013, we forced the separation of all those things. We said, if you're going to have this project and this project and this project, we want to track the financing on each one of them to make sure that we're tracking those individually as projects. And I don't think we should have put these two together like you did, because it just makes it harder to track it fiscally. Anyhow, I've said my piece, and thank you for your time.
Thank you, sir. Anyone for?
Not for, but.
We have another, okay, thank you. We have one to read that was emailed.
Yes, would you like me to read it? It was emailed to you.
Please,
this
yes,
afternoon.
ma'am.
Okay. So, Mr. Chairman and Commissioners, I present my thoughts to you tonight concerning the public hearing on the new library and emergency.
Name and address, please.
It's Robert Quilty, 1413 Brentwood Place, Sanford. I present my thoughts to you tonight concerning this public hearing on the new library and emergency communications system financing agenda item. While I could not comment on why you are combining a separate equipment purchase radio system with a new library and a bond, or why more consideration wasn't given to build a combined college/public library to save cost. Instead, I'm going to comment on the hearing process itself. My knowledge of public hearings, at least in the past, was where the officials presenting the proposal held a public hearing, sometimes more than one, listened to the public comments, pros and cons, and then went away to discuss what the public had to say. At least that's the way it used to be. For the public to make informed comments, we need information. In reviewing the documents attached to this agenda, they are devoid of pertinent information. For example, none of the trust agreements proposed have any monetary values filled in where specified. Also, the bond being proposed is for A, to pay costs for the new library and radio system, and B, certain financing costs relating thereto. What are the financing costs? If you haven't accepted the bid contract yet and you haven't finalized the bond, how do you know what the financing costs are? Did you just throw out a shouldn't be more than number just to include an amount in the bond? What is the number? These are just a couple of examples where we, the public, have little or no information on these projects in which to make intelligent comments. Public hearings are supposed to be where the people, being properly informed, make comments on proposals, not where they are just told what you as commissioners have decided to do. If you are just going to tell us what you're going to do, you can do it at a regular meeting. Don't call it a public hearing as if we, the people, have some say in the matter.
As for tonight's public hearing, it has come to my attention that both the acceptance of the library building bid and the bond for the same will be passed. Bad enough that you aren't accepting the bid and doing the bond on the same night. Did I say that right? Bad enough that you are accepting the bid and doing the bond on the same night, and what that action raises questions about, but that you are doing it at the public hearing. For all the reasons I have outlined, I only hope this is not what you are planning to do. If you do, you will show everyone in Lee County that you are only holding this hearing in a perfunctory manner just so you can appease yourselves and say that you had one. It will be exposed for the shame that it is. Better that you table the vote on this until after the hearing and at least give people of Lee County the feeling that you do want to listen to them and actually give thought and answers to what they have to say. Thank you, Robert Quilty.
Thank you. Anyone else for? Anyone else opposed? Going once, going twice. Public hearing is now closed on the new library and emergency communications financing. Next item on the agenda is resolutions regarding new library and emergency communications limited obligation bond series 2024 financing. Candace, you're back.
As part of the next steps in the debt issuance process for the limited obligation bonds, Series 2024, for the new library and emergency communications system, the board will need to adopt 2 resolutions. Please note that the board will need to waive its policy to take action the same night as the public hearing.
Yes.
You need a motion.
Do I have a motion to waive the board's policy to take action the same night as the public hearing on the library and the radio funding?
Is there an opportunity to ask a few more questions?
Can we ask a few more questions before we move forward?
Yes.
We certainly can.
Okay. So going back to the breakdown, I guess it's more of a clarification question. And what was approved in the 2023 budget and 2024 budget? Viper Radio had I guess I don't want to misspeak. Not approved, but approved in the CIP was $6 million. I guess I was never under I was never operating under the assumption that we were be using bonds for that. I thought that was something that was going to be coming budgeted in. I do think in the bond request, I get really cautious with round numbers because I haven't bought anything that has a round number to it. So I understand that there's bond cost and furniture and things broken into, but I feel like furniture is not going to necessarily be needed immediately. I feel like that's a budgeted item that we can, with our budget coming up for the 2025 fiscal year, that we could pull out. The Viper Radio, I'm not understanding why they were both lumped under one entity, and why we're kind of just throwing a number out there and hoping we capture what we need to spend. And I'm not feeling super confident in, I guess, the amounts and how they're not necessarily broken out in it.
So they will be 2 separate projects. It is combined into one financing. Okay, the Viper project is more than just radios.
Mm-hmm.
We are having to help, let me see how to best say this, to expand the Viper system for the state. We will be paying for work that's done onto the state Viper system in addition to the radios.
Mm-hmm.
We have that cost broken down. We will also be using some E911 funds to pay for some of the work that will be done at the 911 center to be able to enhance the system.
Mm-hmm.
So we are at the mercy of the state on some of the requirements that they've made us, and that's some of the cost differential that we saw from last year to this year.
Mm-hmm.
So, but it will be a separate project. However, we are doing basically an installment financing. It's very equivalent to a home mortgage for you. So the bank wants collateral. Rather, we can't really put the equipment that's going to actually go into the state system when all's said and done, and the radios that we'll be buying for the fire districts and the Sheriff's Department and Town of Broadway up as collateral for the loan. It's just not going to be easily feasible. So we can use, the way the state allows us to do these bonds, we can use the collateral of the library to fund the library project and as the collateral to fund the radio project, okay? So the library, yes, there's the furnishings cost and everything, but typically when you do a major project like this, the first round of equipment and furnishings is paid for through the financing. Because it would be another issue that we'd be facing next year in the budget request, that I would be saying I need a tax increase to be able to pick that amount up. So, because we're looking at roughly furnishings, we're looking at a budget right now of over $1.3 million for the furnishings. And that encompasses more than just desk and stuff. You're also talking moving of the library books and everything over to the new facility and other things that have to be put into place, the sound systems, the lights, everything. For the multipurpose room and other rooms. So hopefully, I think I've tried to answer most of your questions. If there's a specific one that I've forgotten, please remind me.
I don't think so. I think maybe as a note for moving forward on budgets, it would be kind of nice to know what the financing thought process is on some of these, because I guess that's where I was assuming we were, and that's my fault for assuming anything, but so if the cost is more than 6 million, are we capable of handling an over amount?
We
Like-
have an estimate from the vendors right now that we should be good on, along with the 911 funds that we can use. Plus, if we are over that, we anticipate, and we have the numbers for, that are anticipated for the sale coming up at the end of September. We anticipate being able to sell these bonds at a premium, just like we did on the bonds for the park. And we took advantage of that premium by being able to do some alternatives for the park. And that's the same thing we're looking at doing here, that we can sell $28 million of the bonds, but we're going to take in more money than that and be able to use that to fund some of the alternatives for the library. And if there is a cost overrun on the Viper project, in the end, after we take out the 911 funds that we can use, that it would help offset that. Okay?
Commissioner Sharp, questions?
None at this time.
Commissioner Connect?
But you saw something about bond scheduling too. Doesn't the state set that up?
Yes, we have to go through the LGC to get our bond sale dates. Now, we have some say-so in when we're trying to do that, but we've coordinated that date with the pricing of the bids. And those bids can only, the vendors will only hold those bids for so long because they're running inflationary risks also. And so we've tried to time our bond sale, with those bids expiring and to take advantage of the market.
Thank you.
Commissioner Lovick?
No questions, thank you.
Commissioner Carver?
Is it true by putting these two projects together, we economize on the amount of money we have to pay for the lawyers and the overhead in order to get it? Is that not true?
Yes, that is correct. Because if we were to do a separate issuance, there would be a whole nother set of documents, a whole nother set of financings that have to be done and more fees involved.
All right. Thank you.
You're welcome.
Any other questions? I need a motion to waive the board's policy to take action on the same night as the public hearing.
So moved.
Motion's been made to waive the policy to take action on the same night as the public hearing regarding the the capital project ordinance for the library and the limited obligation bonds for the Viper radios. All those in favor?
Discussion, please.
This is discussion regarding the overriding the policy.
Yes.
Yes, please.
Because we're overriding a policy and there were questions from the people out there, I'm trying to figure out if in fact we end up passing this and then we don't like the terms that we receive from the financiers, We have the capability as commissioners to turn that around at that point, do we not?
You could pull out of the financing, yes, sir.
Okay, I know there would be some fees that we would end up having to pay, right?
Yes, sir.
Okay, but there seemed to be some really concern about whether or not we were being transparent enough or not, but I'm not sure how you can be transparent about things when we have to make some assumptions and give them a package that they can come up with the amount they're willing to finance and their interest rates and things like that, right? You don't know those in advance.
No, sir, we can speculate, and we have done that. Mr. Cole is here with Davenport tonight, and he can tell you based on, the estimates that we've ran at a 5% interest rate versus what we're looking at potentially on a sale in September is a good differential. And, he'll be glad to come up and explain that if you don't too. Same thing as financing costs are dependent on what we actually end up issuing and what the interest rates are to come up with the financing costs. So, yes, there are things that we have not disclosed, that's because we aren't sure of the numbers yet, but that will be disclosed to you all.
But you made the best estimate you could.
Yes.
Okay.
And this is what we've done for years. I mean, this is the process, and it's approved by the LGC.
But I'm just trying to address, and because we're talking about possibly doing this tonight instead of giving more time, I'm not sure if we gave more time to it, we could give the kinds of things that we've been asked for tonight. We have to go ahead and be patient and see what comes back. And in the end, if we had to pull the string on it and say, no, we're not going to do this, we could still do that. Just the same as if you go in to ask for money for mortgaging a house, I guess. Anyway, that's the only questions I have.
Thank you.
Commissioner Levick, question.
Is there any advantages at all if we did separate the projects?
As far as
Or as
financing,
financing.
no, because I would not have collateral to do the Viper project without them being combined, one combined financing.
Okay, thank you.
Commissioner Connect?
Thank you.
Commissioner Vorbeck?
No, sir.
Commissioner Sharp?
Nothing.
All right, we have the motion. We've had discussion. All those in favor of waiving our policy signify by saying aye.
Aye.
Any opposed? Thank you. Moving on.
The first resolution, resolution making certain findings and determinations regarding the proposed financing of a new library and emergency communication system and requesting the local government commission to approve the financing arrangement.
Questions for Candace? Commissioner Sharp?
None at this time, no.
Commissioner Vorbeck?
No, sir.
Commissioner Connect?
Thank you.
Commissioner Levick?
No questions, thank you.
Commissioner Carver?
This is a resolution, right?
This would be the resolution to approve the capital budget ordinance for the library, moving forward with the, resolution regarding new library and emergency communication systems, yes.
Just to clarify the transparency issue, is there a requirement to read resolutions prior to passing them?
I don't think so. It's in your budget. It's in your agenda, so
Okay, that's fine.
all the wording is in there.
For the interest of the public, though, we're not doing anything sleight of hand. They are published. So.
Yes, sir.
So the resolution making certain findings and determinations regarding the proposed financing of new public library and emergency communications system improvements and requesting the local government commission to approve the financing arrangement. That should be the motion.
You're looking for somebody to move? I move that motion.
Okay. Motion's been made for to pass the resolution making certain findings and determinations regarding the proposed financing of a new public library and emergency communication systems improvements and requesting the local government commission to approve the financing arrangement. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed?
No.
The records show we have one in opposition. Thank you.
There's one more resolution. The second resolution is resolution approving and authorizing the sale and issuance of limited obligation bonds and the execution and delivery of a master trust agreement, a first supplemental trust agreement, a deed of trust, and related documents in connection with the financing of a new library and emergency communication system.
You've heard the resolution approving and authorizing the sale and issuance of limited obligation bonds and the execution and delivery of master trust agreement, first supplemental trust agreement, a deed of trust, and related documents in connection with the financing of a new public library and emergency communication systems improvement. Do I have a motion?
So moved.
Motion's been made to approve the resolution. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed?
No.
Do you have the record, Madam Clerk? Thank you. Moving on to the next item
Thank you.
on. Thank you, Candace. Thank you, Mr. Cole. Thanks, Jennifer. Jennifer's up.
All right. Before you this evening, I have a request for approval for the guaranteed maximum price related to the construction costs for the Lee County Library project. This is associated with the construction manager at risk process, which was identified for this project. The board originally approved the resolution identifying the CMR process back in November of 2021. At that time, Sanford contractor Samet Corporation was selected to serve in this capacity. The benefit of a CMR process is that your CMR also works with your designer or architect to, during the design process, to identify issues, material availability, construction lead times, also cost estimates during that time, hopefully to achieve some savings, avoid some change orders later on, so there's many benefits to the process. The CMR serves kind of virtually like a general contractor. They oversee the bid process. We had 35 bid packages in total, receiving 109 responses. They provided those pre-construction services. So your GMP includes your CMR fee, your construction costs, your insurances, your performance and payment bonds. It does not include things like your design fees, the outside sewer connection costs, which were previously approved by the board, site preparation, third-party testing, debt issuance costs, furniture, costs related to audiovisual, security equipment, and some of the contingencies that we built into the project. So for this project, we identified a budget of $24 million. That's where we landed. $22 million is included with the limited obligation bonds that were set forward this evening. $2 million of that is included with the ARPA revenue loss funds. So that's our budget. The identified guaranteed maximum price that was presented to us by Sanford contractor Samet Corporation was $18,784,275. And we have a resolution in your agenda package for your approval consideration this evening. I'm happy to answer any questions.
Questions for Jennifer? Commissioner Carver?
No questions.
Commissioner Levick?
No questions, thank you.
Commissioner Connect?
Thank you.
Commissioner Vorbeck?
Hello. The CMR, when we toured the jail in Forsyth County for the NCACC, was this similar to what he was explaining they used? And it allowed for a lot of cost savings and, or I should not say a lot of cost savings, but it kind of helped the project stay on budget. And they echoed that it was, having one of these was a very good.
And I think the idea, and I've heard this reiterated multiple times, is that you may not achieve a significant cost savings, but you end up with a better quality product because you have your contractor on board earlier on.
Okay, all right, thank you.
Commissioner Connect?
Mr. Sharp, I believe.
Oh, I'm sorry. Did I started there and went this way? I got so distracted. I apologize. Commissioner
None,
Sharp?
thank you. None.
Okay. All right. Do I have a motion to approve the guaranteed maximum price in the amount of $18,784,275 for the Lee County Library project?
So moved, Mr. Chair.
Motion's been made. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? Thank you.
Thank you.
Moving right along. Thank you. Planning, Amy McNeil, are you there? I didn't know you. Planning Board recommendations regarding a request to rezone .5 acre and add 1.24. Anyways, go. It's all yours. Thank you. Good to see you again.
Oh, good to see you again, too. The Planning Board met on July 15th after the public hearing was held and recommended by a unanimous vote that the Commissioners approve the request to rezone a half-acre portion of a 1.25-acre tract of land addressed as 631-655 Bruce Coggins Road from residential agricultural to residential restricted, because it is reasonable and in the public interest, since it would continue to allow single-family dwellings as a land use, which is the primary land use allowed in residential restricted, and the site is in an area along Bruce Coggins Road that has residential restricted zoning and access to public water. Topics of discussion included that the applicant recently purchased additional acreage to the rear of his lot and legally added it to his lot via the recombination process. Therefore, it makes sense to have one zoning district assigned to the entire lot. Also, the majority of the lot is already zoned residential restricted, and there are lots of RR zoning in the area. The board acknowledged by a 6-to-1 vote that the rezoning request is not consistent with the Plan San Lee long-range plan designation of countryside because the request is for a smaller lot size or a higher density than is allowed in the current zoning of RA. The recommended development density is 1 dwelling unit per 2 acres, and the intent of this place type is to encourage the conservation and maintenance of a rural lifestyle with limited residential density. As a reminder, the Commissioners should make 2 votes regarding this matter. Sample motions are provided for your reference, and Commissioners are always welcome to draft a unique motion if preferred. Also, the Commissioners may acknowledge that the zoning map amendment is not consistent with the Plan San Lee long-range plan and still vote to approve the request. Are there any questions?
Questions for Amy? Commissioner Sharp?
None.
Commissioner Vorbeck?
No, sir.
Commissioner Connect?
No, there's already a lot of R around that area, isn't there?
Yes, sir, there is.
Yeah. Thank you.
Commissioner Levick?
No questions.
Commissioner Carver?
None.
Due to the fact that this is not consistent with Plan San Lee, do I have a motion, option number 2?
I make a motion for option number 2.
Motion's been made for option number 2. Proposed zoning map is not consistent with the Plan San Lee designation of countryside because the request is for a smaller lot size, higher density, than allowed in the current zoning district of RA. The recommended development density is 1 dwelling unit per 2 acres, and the intent of this place type is to encourage the conservation and maintenance of a rural lifestyle and limited residential density. Any further discussion on the motion? All those in favor signify by saying aye.
Aye.
Any opposed?
Commissioner Sharp, I make a motion that the board approve the proposed zoning map amendment from RA to RR.
Motion's been made to approve the proposed zoning map amendment from RA to RR. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? Thank you. Now, if we would be so kind as we have been here for going on almost 2 hours, can we please take a break? And please start the timer, Colin, for 10 minutes.
Coming to you weak for a while now. You got me feeling like a child now. 'Cause every time I see your bubbly face, I get the tingles in a silly place. It starts in my toes and I crinkle my nose. Wherever it goes, I always know that you make me smile. Please stay for a while now. Just take your time wherever you go. The rain is falling on my window pane, but we are hiding in a safer place. Undercover, staying dry and warm. You give me feelings that I adore. They start in my toes, make me crinkle my nose. Wherever it goes, I always know that you make me smile. Please stay for a while now. Just take your time wherever you go. But what am I gonna say when you make me feel this way? I just, and it starts in my toes, makes me crinkle my nose. Wherever it goes, I always know that you make me smile. Please stay for a while now. Just take your time wherever you go. I've been asleep for a while now. You tuck me in just like a child now. 'Cause every time you hold me in your arms, I'm comfortable enough to feel your warmth. It starts in my soul and I lose all control. When you kiss my nose, the feeling shows. 'Cause you make me smile, baby, just take your time now, holding me tight. Wherever, wherever, wherever you go. Wherever, wherever, wherever you go. I'm feeling further from you every day. You're in the stars, yeah, your world's away. I'm moving on, then I hear you say, hold on, hold on. We're losing light, yeah, we're fading fast. We had a fire, need a spark, oh, I'll never last. Just look at me, I've been burning for you so long, so long. I should walk away. I look at you and I get the feeling. I think that I should hold on, hold on. I look at you and I get the feeling. I think that I should hold on, hold on. I'm losing love, losing you, losing everything, losing faith in the world where I wanna be. So I don't care if the one thing that's killing me is so wrong, so wrong. I should walk away. I look at you and
Okay, we are now reconvening. If I can find my commissioners. Oh, there they are. Thank you for that recess. We still have more work to do. Next item on the agenda under new business is resolutions to add the community sports services to the Lee County Consolidated Human Services Agency.
I'm going to take that.
And the attorney is going to go.
Yes, sir. Thank you. So as you all remember, the commissioners established the Consolidated Human Services Agency effective July 12th of 2023. At that time, that consisted of the Health Department and Department of Social Services. Then, since then, the board has also consolidated senior services to that agency, and that was on effective January 1 of 2024. Now that the assistant county manager is the over the department, the newly formed Community Support Services Department, and considering that they, Community Support Services, DSS, Health Department, Senior Services, oftentimes are dealing with similar individuals or with individuals with the same type of, needing the same type of services, we are requesting to consolidate Community Support Services also into the Consolidated Human Services Agency and have that effective September 1st of 2024.
Questions for Whitney? Commissioner Sharp?
None.
Commissioner Borbett?
I don't have any questions. If I could make a request onto this, or if I can do that, I guess maybe at commissioner comments, but would we be able to get an updated version of who's in charge and kind of the breakdown of
Flow chart?
the float, thank you. That was the word I was looking for, a
An
flow chart of
organizational
departments.
chart
Yes.
across the
chart.
board or just with the Consolidated Health?
Across the board,
Yep.
please.
I'm
Okay,
sure we can
thank
do
you.
that.
Commissioner Connect? Commissioner Lubbock?
No questions, thank you.
Commissioner Carver?
The only thing I want to say is it's a word of caution. Again, I recognize the fact that I'm leaving, and you guys are going to be handling all these things again. But if you look at the idea behind this agency, it was to bring things together in an effort to be able to improve service and possibly reduce costs, I guess, be more effective. A lot of good things have happened. What I'm concerned about is building an agency that's eventually going to have a high-paid director. Right now, we have it being taken care of by an assistant, which I hope in the future budgeting, et cetera, is maintained. Before, we used to have the Department of Health and the Department of Social Services, and they were overseen by the county manager. I just feel like if we're not careful, this is an area where our appetite for bigger government could become worse. So go ahead and continue to think about the good things that we're doing by making these kind of decisions, but generally avoid increasing costs for personnel. That's just a general comment, I guess.
Point well taken. Just one thing, when attending the conference last week, they did bring up the issue of growth, and the projected growth for this county is astronomical is a good number to use for what they're projecting in 2050. So unfortunately, you have to provide services to that additional growth. So point well taken. Any further discussion? Do I have a motion to approve the resolution to add Lee County Community Support Services to Lee County Consolidated Human Services Agency?
So moved.
Motion's been made. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? Thank you. Next item on the agenda is memorandum of agreement between Lee County Schools and Lee County Health Department fiscal year 24-25. Who wishes to take
It was, yep. I just had questions for it. Oh.
questions? Go. This is a request for commissioners to review and approve the revised memorandum of agreement between Lee County Schools and Lee County Health Department.
Yes, sir. My questions were on the sheet, and it may just be left blank for a reason, but it did state that on page 4 that we needed to list the names of the nurses that would be paid by, and if it wasn't filled at the time of the thing, of the request, it would be listed as vacant. Will those be filled in with names?
The documents themselves are just a template to go by.
Okay.
Charlotte gives us the names after the completion, and at that point, we have to put them in NCR to get them into the system so they can do their work in the school system.
Okay, then, so, I guess is this different than the nurses that are on staff at school? Like BT Bullock has a school nurse?
We pay $150,000 a year, and that covers almost 3 nurses' salaries. And they give us a timesheet every month of how much they've worked with that school, and then we are a pass-through for that monies to get back to the school system.
Okay, so is there, I guess my question is there more than 3 school nurses within the school system, or is there only 3
There's
nurses?
more than 3. Last I heard, there were about 15.
Okay, and so they get, I'm just trying to figure out why it's just 3 nurses that this memorandum is, or of agreement is being paid for and other ones aren't. So that's where I'm just trying to.
There are certain counties in the state, it's like Tier 1, Tier 2, and Tier 3. And if I'm not mistaken, I think we are still at Tier 1, which that gives $150,000. Some get less and some get more, depending on the population.
Okay, and are they currently serving in the schools, or they're on top of their school nurses? I guess, are they floating, are they assigned to school?
That would be a question for the nursing supervisor. I'm not sure.
Okay.
I just know that we have 3 that we are documenting to be the pass-through to pay for those services. And part of that contract is they've helped us a lot through the flooding events we've had when they've manned the shelters and things of that nature. But part of that, too, is for us to provide training to them so they can do the things they need to do in the school system.
Okay.
But that is not just those 3. That is all of the school nurses that we train.
Okay, that's good to know. Okay, thank you so much.
Yes, ma'am.
Commissioner Sharp, questions?
No, thank you.
Commissioner Connect?
Thank you.
Commissioner Lovick?
None, I move to approve that.
Commissioner Carver? Did you make the motion to approve?
Yes.
Motion's been made to approve the request for Commissioners' review and approve the revised memorandum of agreement between Lee County Schools and the Lee County Health Department. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? Thank you.
Thank you.
Moving on to the next item, 11K, the budget amendment. And there's questions for the manager, finance director. There she is.
Yes.
That is item, I wrote it down. 2K. Item 2K from the consent agenda.
Thank you.
Do you want me to start? Since
Please
I
go.
pulled it.
It's yours.
Sorry, I know.
No problem, no, that's what it's for.
I guess it's more just trying to understand this, since this finance is obviously not my background, so that is your, multiple people in here, strong suit. When it comes to, because the only change orders I've ever dealt with is in construction, so, and it's money typically owed out. And so I'm trying to figure out I'll use one of them as an example, where is it? So, under the social services adoption enhancement, the current budget is $15,000. There's been a change of $295,726. Is that coming from us? Is that coming from state funds? Sometimes it's hard to know, is it pass-through money that we've gotten type thing? And is there a way to, maybe we've never done this before, but just trying to figure out, because when I see the total of the $1.1 million, is that money, where did that money come from, I guess is.
So those are rollover funds that have been
Okay.
rolling over for several years, and they did come from the state. And those are specified for specific things via DSS until we use them up. Would adding additional language to the summary of the budget amendments help?
I mean, I know they did some of the
the summary on the pass-through, and like, so would that be the same thing for the fund balance appropriated with the current budget, and then the change, is that rollover funds?
That depends.
Okay.
Which one are you talking about?
Sorry, it says, the very first line is fund balance appropriated, 6.7 million is the current budget, change was $653,852, with a new budget of 7.3.
So that would be comprised of rollover funding, primarily for different departments who maybe ordered or got into a contract for services in fiscal '24, and they were not completed by June 30th, and so therefore, we will roll those funds over, so they will still have the funding available to take care of those needs.
Okay, I think I'm following more. I thought, okay, so is the majority of these all rollover, or some of them we're pulling money from another source?
So it varies.
Varies.
This time of the year, we're doing a great deal of rollovers. This year, actually, we have more rollovers than we have had that I can recall.
Is there any way to add, good scenario or option is there another line item that would state rollover like on the spreadsheet or not?
No, whenever the budget year ends, whatever funds have not been used are essentially go back to fund balance. So that appropriating fund balance is how we identify the rollovers. But like I said, I can provide more information within the summary that will detail as much as you'd like to know.
Okay.
But like I said, there are a great deal of rollovers.
Okay.
If you'd like that information, I can definitely provide that to you.
Okay, okay. Yes, because just sometimes it would be kind of nice to know if that, like, if indeed it was more rollover than it was money we needed to pull out of another source that
Right.
wasn't budgeted for. Because like, you know, like the example I was using, I mean, there's a couple of them, like the health and communicable diseases, the contract service current budget was $8,400, and then they've got a change of $135,000. So like, how does that affect their, my brain, I guess, just goes to then what was their budget request, and is some of that funds being used, and what's causing them to roll over this amount of money, I guess.
There could be a variety of
Yeah.
reasons.
Okay.
Just the inability to spend the funds in a timely manner. It could have been they may not get the funds till late in the fiscal year. Sometimes funding is available, and then it comes up February, March, they find that a county's not using up all their funds, so they say, who's, got some to turn in, and, we raise our hand, hey, we can use it, and so that's what we do, or that's what the health department will do.
Okay. So is this better, a way to look at it, budget amendments is more, hey, there's funds that became available, versus, I guess when I looked at this, it looked like it was gonna cost an extra $1.1 million. Does that make sense on how I'm viewing it versus how it probably should be viewed?
So these
Because
are,
if it's rollover, then it's money that was already distributed, so it's not money we're spending again, right?
so these are,
Allocated, yes. Okay,
so these are state funds that are coming down.
okay,
And so that's just how we allocate them. They were never actually they're not actually our funds yet. More likely than not, they are recent reimbursement monies.
okay,
And so we have to spend it in order to get that money back.
exactly. Okay, all right, I appreciate it.
I think it's just easier for a vote when she sees that it's rollover money coming from the state, pulling it out of our.
Absolutely.
Yeah, that's kind of, I guess
Yeah.
that's the channel on which it's flowing.
Absolutely. I can definitely provide additional information in the summaries. Would you like that in regards to this particular budget amendment?
When you have time, that you probably don't.
We actually had to create a spreadsheet this year to keep up with all the rollovers, and due to the fact that there are some invoices still dragging in from fiscal '24, We have not completed those rollovers, so I will bring rollovers to you in September as well. These are for like larger projects where there may be architecture and engineering, that we're, and construction, things that we are still trying to round up invoices for services and goods that were received. So, like I said, we just kind of having a record year this year with things that we couldn't finish, and so we're having to bring it into the new
The main
fiscal
thing,
year.
these were allocated for 1 year, project wasn't finished, now we're just bringing it over to the next year.
Yes, we don't want to penalize the department. For instance, Recreation had a vehicle that they had ordered. They waited all year, literally 13 months, for that vehicle to come in. And the tax and tags on it, between that and some other circumstances, would literally have blown their maintenance to vehicle budget if we had not allowed them to roll that over. Now, that's a special circumstance that we don't necessarily do, but things like capital outlay, body armor for the sheriff's office, their body armor is special made, and so it takes time. It may have been ordered back in March, and it's still not in. We're not going to penalize them this next fiscal year and make them have to eat that difference, because it can get quite costly.
Okay, I appreciate it. Thank you.
Okay, all right.
Commissioner Sharp? Questions?
No, I don't have any.
Commissioner Connect?
Thank you.
Commissioner Lovick?
No, ma'am, thank you for the
Commissioner
explanation.
Carver?
No question.
Do I have a motion to approve the budget amendment 08-19-2402?
So moved.
I have a motion to approve the budget amendment number 08/19/24/02. Any further discussion? All those in favor signify by saying aye.
Aye.
All those opposed? Thank you. Whew. Managers report. Monthly financial reports. Why? She's here.
One last thing, the preliminary monthly financial report for June is attached for your review. There are other revenues and expenditures related to fiscal '24 that will be booked between now and mid-August, hence the later rollovers. At this time, we are at 106.55% of our ad valorem budget, and there are no departments that finished over budget. The sales tax revenues received through May 2024 are also attached for your review, and we are 3.64% above revenues for the same period last fiscal year. This report does run 3 months behind, so I will be bringing June to you, June sales tax to you next month.
Questions for Candace? Commissioner Carver?
None.
Commissioner Lovick?
No questions.
Commissioner Connect? Commissioner Vorbeck?
No, sir.
Commissioner Sharp?
No questions.
Thank you very much.
Thank you.
Managers report.
Okay, I want to start off by saying again, congratulations to our Renew team for winning the Innovations Award. It was a very proud moment for Lee County. We actually kind of got skipped over at the conference when they were announcing all the awards and had them come up on the screen, which was really cool because they had asked for all the applause to be held until the end. And since they realized that they had skipped over us, we got the most applause for our program. So we're very proud of that. I am going to ask Angelina to come up and introduce a new team member to our community support program to you real quick, and then we'll move on to the other things. And Christy was not here tonight to be recognized as part of the program because she is on vacation, a well-deserved vacation, so.
Did she get caught in the hurricane?
No, I think she went down after the hurricane.
So, good evening, Commissioners. So real quickly, want to introduce you to our UNC Lead Fellow, Emma Bach. Emma Bach is joining us as a recent Elon graduate, and her interest is actually public health. So it's been a great opportunity, so I will let her speak a few words to you all tonight.
Hi, I'm Emma Bach. Thank you so much for having me here. Super excited to get to work with everyone. Everyone's been so incredible so far. As Angelina said, I just graduated from Elon in May with a Bachelor's of Arts in Public Policy and Public Health with minors in Human Service Studies and Political Science. Before this, I worked at Stanford Children's Hospital doing some health legislative advocacy work. So this opioid work kind of falls right in my line of interests, and so super excited to get started.
Welcome, thank you.
Thank you.
Thank you, Angelina. Emma. As far as our projects going, Lee County Athletic Park, we did have a slight impact from the Hurricane Debbie and the rain that we've had recently, but construction is still continuing. As far as building construction goes, 4 of the 5 building foundations are completed. 2 buildings have vertical walls and wood beam roofs installed. Fieldhouse B has a foundation in place and is starting vertical wall construction. The maintenance building has a foundation with metal framing and trusses installed. Field construction, ball fields are under construction. The perimeter drainage is installed underground, and now work on fields is starting, along with the installation of sand and clay for all 4 ball fields. Rectangular fields are at rough grade and will be the focus of the builder after ball fields are completed. Lighting is installed on about 75% of the site and will be completed once rough grading is complete on fields 7, 8, and 9. Parking lots A and B have the base layers of asphalt installed, and finalization of stone base at parking lot C will complete base asphalt installation for the remainder of the site. As we get closer to completion, the final layer of asphalt will be done in the parking lots. We continue to work with D.R. Horton and McAdams to finalize the Duke Power easement between Ashby Village and the Lee County Athletic Park, with a plan to bring it to the board in September of 2024, once all the associated documents have been completed. We are continuing to work with change orders, and we'll be vetting those and possibly bringing those to you in the September 2024 meeting. And we'll provide you more details when that time comes up. Kiwanis Children's Park, the project includes new sidewalk and installation for future connection to Kiwanis Family Park, along with a new playground. Part of the work has been completed. The shelter has been ordered and is scheduled to ship September 9th, and we're continuing to work with the playground people to get all the bathrooms, shelter, and the playground installed. O.T. Sloan Park Accessibility Project. The original project includes pavilion, restroom renovations, and seat retaining wall, playground and surfacing playground entry gates, sidewalk, parking, striping for handicap spaces, parking improvements, landscaping, site preparation, lighting, site furnishings, and fencing. The original project budget came in above that, what we had allowed, so we've had to modify that scope of work, reflecting a reduction in work for the project has been reviewed and approved by NC State Parks and Recreation. The reduced scope includes removal of the restroom renovation and 3,000 square feet of sidewalk. We are now working with the architect, Withers and Ravenel, to update bid documents reflecting the scope of work reduction, and after documents are updated, they will be going out to rebid. The playground equipment and installation are being provided by Bars Recreation, and equipment has been delivered on site at O.T. Sloan Park. As you know, we awarded the GMP tonight, or approved the GMP for the library project, and they're working on the RFQs for third-party testing for that project. And we are on the LGC approval for September 10th, with a sale date of September 25th for that financing, and a closing date of October 10th. Historic Courthouse. The renovation project currently focused on roof replacement with alternatives for masonry repairs and stormwater management. The project is currently out to bid and is predominantly funded under the Emergency Supplemental Historic Preservation Fund grant. A pre-bid meeting was held on July 31st at the Historic Courthouse, and we have received confirmation from the state and the grant administrator that additional funds of $185,000 will be added to the grant. So that is wonderful news, and a confirmation has also been received that the grant deadline will be extended through December 31st, 2026. We are asking that you give me approval. The documents will come in on DocuSign, and so we are asking that as those move ahead and they are reviewed, that you give me authority to sign those documents, if possible.
You need that now?
Yes, sir, if you don't mind.
So moved.
Motion's been made to give the county manager authority to sign the documents on the historic courthouse renovation project. Any further discussion?
Sorry, moved.
Oh, he made the motion. I just said the motion. Any further discussion? All those in favor signify by saying aye.
Aye.
Any opposed? Did you get that, Madam Clerk? Do you get the motion that we're giving the county manager authority to sign by DocuSign the documents on the historic? Yes,
That's
Dr.
Dr.
Knapp.
Knapp.
I'm
Thank you.
sorry. Start working on speak into the microphone. Hello?
Okay. Moving on to Horton Park, we, at the December 23 Board of Commissioners retreat, Commissioners requested improved parking options for Horton Park and Pool. We are working with J. Thomas Engineering has been approved for that project. The preliminary design was reviewed by the board and is submitted to DOT for review and approval. So we're continuing to work on that project. Government Center, the generator and generator equipment function today, but they are beyond the useful life. Lee County has worked with Dewberry Engineering to provide drawings and bid documents for the generator and switchgear. The budget does not allow for replacement of both the generator and the switchgear as originally planned. The project will focus on the switchgear, which is the infrastructure connecting the generator to the building, as the base bid due to the immediate need to replace as replacement parts are no longer readily available for the current equipment. The project has been put out to bid, and RECOR is the lowest responsible bidder. A meeting was held on July 30th with RECOR, Dewberry Engineering, and Lee County to discuss the project and help finalize project contract terms. Equipment lead times are currently 12 months and will require coordination between the contractor and Lee County. To minimize the impact to county operations, the project is to be scheduled targeting a holiday weekend with only 2 business days anticipated of operational downtime, with the government center will only be on backup power while the primary installation is taking place. We are hoping to be able to accomplish this over Veterans Day weekend of 2025. And we'll be bringing the contracts and other approvals to you in future meetings. Various reports are attached, and just a reminder of upcoming meetings and events. September 2nd will be closed for Labor Day. September 10th, we'll be doing a rewards and recognition for our STARS program at 8:30. And September 16th, we'll have our Lee County Board of Commissioners meeting, and then remember, we go back to a regular schedule in October, and we'll have the 2 meetings, October 7th and October 21st. I believe that is everything that we have.
Thank you. We'll move on with commissioner comments, starting with Commissioner Sharp.
Yes, sir, Mr. Chair. I just want to thank everybody who had a part in moving the library along. Sometimes we got to make tough decisions, and, you got people up here opposing. But thank you for having the courage to move forward and move Lee County forward and not backwards. Thank you.
Commissioner Vorbeck.
I was a part of some of the commissioners and team that got to go to the NCACC in Winston-Salem last week and braved the storm Debbie. But it was very informative in some of the breakout sessions that I got to go to and be able to speak on behalf of Lee County and the stuff that we're able to do and versus what some of the other counties are doing. And I think we gained a lot of information to be able to pull back, and I know staff was busy and their minds were turning on things that they could do and ways to continue to help Lee County grow and be a really good place to work as well.
Commissioner Connect.
Congratulations to the awards. It's good to see. I'm good. Thank you.
Commissioner Lovick.
Yes, again, congratulations. I hate I missed the conference. I had a little hiccup on health-wise. Congratulations to the Lee County Gymnastics team and things they did. And I would like to thank each person, each one of you staff, each one that hears me anyway, for the prayers, the cards, the calls, the texts, the emails, the meals, whatever you've done. Thank you. Like I say, my biggest cheerleader back there is the supporter, my wife. Got to thank her big time. But I want you to know, through this, what I'm going through, God's in control.
Amen.
Thank you.
No comments, thank you.
Thank you. And Commissioner Lovick, I still bug you every other day, so I just want to keep check of you.
Thank you.
I want to do same as to congratulate the awardees, our county attorney, our Renew program, as well as the staff with the Reentry Council. Thank you for the finance ladies and gentlemen. Do we have any gentlemen in the finance section? Oh, okay. No, that's fine. I'll maybe one day. But I just want to say thank you for all the action we had this evening. It's been pretty busy. We do have a closed session stated, and we will have business after the closed session. So
And it is two separate items in closed
two
session, just to be
motions for the
clear.
closed session. You have both of them, sir?
Yes, Chairman. I move that we go into closed session per NC General Statute 143-318.11A3 to consult our attorney to preserve the attorney-client privilege.
That's
and-
one.
Huh?
That's the first one, thank you.
Yeah, and to consider and give instructions concerning potential for action, claim, administrative procedure, or judicial action in Eric Rodman versus Lee County Emergency Service, Lee County, and John Crumpton.
Motion's been made. Any further discussion? All those in favor signify by saying aye. Aye. Any opposed? Thank you. We're now in closed session. We will go that way.
I don't want to make you.
I can't even see this.
This is the.
Okay. We're back in open session.
What about the dog?
All right, the first item on business is a resolution delegating authority to the county manager to settle certain lawsuits and execute documents. Whereas the Lee County Board of Commissioners pursuant to North Carolina General Statute 153A-11 has the power to sue and be sued and the authority to settle, approve, and sign legal settlements involving the county, its elected officials, employees, agents, or entities, and to execute documents related to such settlement. Whereas the county manager is the chief administrator of Lee County pursuant to North Carolina General Statute 153A-82A and is involved in the daily workings of the county. Whereas some legal suits and settlements require no monetary payments from the county or require payments to the county or require minimal monetary payments to another party for settlement. Whereas the board is of the opinion that it is in the best interest of the county to delegate to the county manager the power and authority to authorize the county attorney to file a lawsuit in cases that involve relief other than monetary payment or that involve payments to be received by the county in any amount or that involve settlement payments to another party less than or equal to $30,000. And whereas the board is of the opinion that it is in the best interest of the county to delegate authority to the county manager to approve, settle, and sign legal settlement agreements and court orders on behalf of the county in cases that involve relief other than monetary payment or that involve payments to be received by the county in any amount or involve settlement payments to another party less than or equal to $30,000. Now, therefore, be it resolved by the Lee County Board of Commissioners as follows, that the county that the county manager is hereby delegated the authority to authorize the county attorney to file a lawsuit in cases that involve relief other than monetary payment or that involve payments to be received by the county or that involve settlement payments to another party less than or equal to $30,000. 2, that the county manager is hereby delegated the authority to approve, settle, and sign legal settlement agreements and court orders on behalf of the county in cases that involve relief other than monetary payment or that involve payments to be received by the county or that involve settlement payments to another party less than or equal to $30,000. This resolution shall become effective upon its adopted this 19th day of August 2024. Signed by the Lee County Board of Commissioners on behalf of the Lee County Board of Commissioners. Now, you've heard the resolution. Do I have a motion to approve? So moved. Motion been moved to approve the resolution delegating authority to the county manager to settle certain lawsuits and execute documents. Any further discussion? Seeing there are none, all those in favor signify by saying aye. Aye. Any opposed? Thank you. Moving on. Next item of business.
Yes, sir. At this time, I have a proposed settlement agreement general release to ask the board to approve. And this is the matter in Eric Rodman versus Lee County Emergency Services, Lee County and John Crumpton. So at this time, I will go over the terms of that settlement agreement and read it. So this agreement is in reference to the following facts. Whereas Rodman asserted claims against the county and Crumpton in the civil action that is Rodman versus Lee County Emergency Services, number 123 CV 796, Middle District of North Carolina. And whereas the county and Crumpton deny the validity of Rodman's claims and deny that either of them are subject to any liability and or have engaged in any culpable conduct. And whereas the parties reached a binding settlement agreement through council. Now, therefore, it is agreed between the parties as follows. So the first is that the recitals contained in paragraphs A through C are incorporated. The second is that upon execution of the agreement, Rodman and Lee agree and stipulate to the following conditions. A, in exchange for and in consideration of the payments, benefits, and other commitments described herein, Rodman and for each of his heirs, executives, administrators, assigns hereby fully releases, acquits, and forever discharges John Crumpton and Lee County as well as Lee County Emergency Services and each of its predecessors assigns officers, partners, board members, employees, attorneys, and agents of past and present of each of the aforesaid entities, related persons, of and from any and all claims, liabilities, causes of actions, demands to any right, damages, costs, attorney fees, expenses, and compensation whatsoever, of whatever kind or nature, in law, equity, or otherwise, whether known or unknown, vested or contingent, suspected or unsuspected, that he may now have, has ever had, or hereafter may have, related directly or indirectly to the allegations in this action, including but not limited to claims for wages, back pay, front pay, reinstatement, damages, or benefits. Rodman also releases any and all state and federal claims Rodman may have that arose prior to the effective date of the agreement, and hereby specifically waives and releases the right to any relief and damages arising from claims under Title VII of the Civil Rights Act of 1964, as amended the Civil Rights Act of 1991, the Equal Pay, the Americans with Disability Act, the Consolidated Omnibus Budget Reconciliation Act, COBRA, the Employee Retirement Income Security Act of 1974, as amended, and any and all federal, state, and local statutes, ordinances, or regulations, as well as in all claims arising under federal, state, or local law involving any tort, employment contract, express or implied, public policy, wrongful discharge, or other claim. B, the county will accept resignation letter from Ms. Eric Rodman, which states, I hereby resign from my positions with Lee County, dated December 1st, 2021. If potential employers request information about Rodman's employment with the county, Rodman will direct the request to the Human Resource Director. The county employee will then provide his dates of employment, positions held, salary, benefit, and that the county accepted his resignation from employment. The county will also provide a neutral reference letter containing this information. The county will not provide additional information regarding employment to potential employers unless an additional release is executed by Rodman or required by law. Plaintiff understands that while this resignation will be added to his file, if someone requests the entire file pursuant to a release he has signed, or because the county is otherwise required to produce his entire file by law, the county cannot remove any documents from his personnel file but will produce the resignation letter. C, the county will cause a check of $57,500 to be issued to Higgins Benjamin PLLC by Sedgwick Incorporated, which check shall be held by counsel for Rodman until this agreement is executed and the complaint has been dismissed with prejudice. This check is to be payable as general damages. A Sedgwick representative has inquired as to whether the check can be payable in Box 10. In any event, it will be payable in a 1099 form. Rodman is responsible for a share of taxes, if any, and shall indemnify Lee County and hold Lee County harmless from the same. Rodman shall not disparage John Crumpton or defendant County and Lee County Emergency Services and any current or former employees, officials, and attorneys in any medium, either directly or by causing another to make disparaging statements, including but not limited to social media, newspapers, and/or streaming services. John Crumpton and defendant County and Lee County Emergency Services, as current county managers, human resource director, and attorneys, shall not disparage Rodman in any medium, either directly or by causing another to make disparaging statements. The parties all agree that except as otherwise provided in paragraph E below, the settlement terms and/or incidents that are led to the lawsuit and settlement will only be shared as required by law. The parties understand that the settlement is not confidential under North Carolina Public Records Law, and the terms of the settlement must be read and approved by the Lee County Board of Commissioners in its regular meeting in open session. The parties acknowledge that Jennifer Davis Miller was not an employee of the county and is not a party to this lawsuit or agreement. However, in the event that Jennifer Davis Miller should disparage the defendants in a manner that references or implicates this lawsuit and its underlying facts or any settlement going forward, plaintiff hereby authorizes and releases the defendants to disclose any and all facts regarding his employment and/or incidences leading to termination. The release extends to any and all information which would otherwise be considered confidential personnel information pursuant to North Carolina general statutes. Similarly, in the event that Jennifer Davis Miller disparages the defendants and/or references this lawsuit or any settlement going forward, and any of the defendants exercise their option to disclose facts regarding plaintiff's employment and/or the incidents leading to this termination, plaintiff would also be able to disclose any facts regarding plaintiff's employment with the county, the incidents leading to the termination, up to the termination and settlement. Except as stated herein, the party shall bear their respective fees and costs, and then the agreement shall be binding and inure to the benefit of the parties and their respective successors. And if any of the provision of the agreement is found to be unenforceable or invalid, the parties agree that the remaining portions remain in full force and effect. The agreement will be construed and governed in accordance with the laws of the state of North Carolina. All parties agree that electronic signatures are effective to make this a binding legal document. and both parties agree that within 3 days of the execution of the agreement and the receipt of said sum described in 2A, counsel for plaintiff shall prepare and file a joint stipulation of dismissal. And at this time, I would just ask the board to approve and authorize the county manager to sign.
You've heard the terms of the settlement. Any further discussion? Do I have a motion to accept the terms of the settlement? Motion been made to accept terms of the settlement as so read. All those in favor signify by saying aye.
Aye.
Any opposed? Thank you, Madam Attorney. We have a motion to adjourn. Any further discussion? All those in favor signify by saying aye.
Aye.
We're now adjourned. Please drive safely, wear your seatbelts, and no speeding. And congratulations on that award.